Do you clench your teeth together? I'm Dr. Chantelle with MyoLab, and today let's talk about everything related to the TMJ. Why do we care what's going on with your jaw? Well, the reality is that a lot of us carry a lot of our stress and tension actually in the muscles of our face. We clench our teeth at night, we grimace a lot, and that can create a lot of joint dysfunction, or TMJD. That joint dysfunction can lead to headaches, it can lead to clicking and popping, trouble chewing, all of that fun stuff. So let's go through a couple of exercises to strengthen, to mobilize the jaw, and help improve that motion a little bit. The first thing we're going to want to do is check the ranges of motion in the jaw. This is best done in front of a mirror so you can see what's going on. With the jaw, we're aiming for symmetry. We want the jaw moving equally side to side in all directions. You have two temporomandibular joints. We want them moving equally so that our jaw moves equally. So you can do this in front of a mirror. First thing you're going to do is just check the range of motion when you're opening and closing your mouth. You want to make sure your chin isn't deviating side to side, that it's tracking straight forward. From there, we want to see how it moves into lateral motion. So you're going to open your jaw a little bit, keep your teeth separate, and shift the bottom jaw from side to side. Next, you're going to check protraction, so shooting the bottom jaw forward, as well as retraction, driving it back. Again, we're aiming for symmetry. We want less than 5 degrees of asymmetry from side to side. So if there's one motion that's moving less than the other, that's the one we're going to mobilize. I'll show you how to mobilize in all directions though. For opening, you're going to essentially encourage that motion. So you can do that by grabbing your jaw and pushing down, adding some overpressure. You can also do that by kind of hooking on your teeth and pulling down. Again, you're looking for gentle stretches. This shouldn't hurt, and we want to take things really slowly. If the lateral deviations from side to side were different, you can again apply some overpressure. So open your jaw, shift the jaw to one side, add a little bit of pressure. For protraction, shooting your jaw forward, you're going to hook your thumbs on the angle of your mandible back here at the back of your jaw, move your jaw forward, and apply gentle traction and pressure. For retraction, you're obviously pushing your jaw backwards with your hand, creating that motion. Now, as we move into strengthening, we can again use overpressure to help that. This time though, we want to push against pressure. So with opening, you're going to kind of add a fist underneath your chin and open into your fist. That's going to make the muscles work harder. Again, we're still looking for symmetry. You still want to make sure that your jaw is tracking nice and straight forward. If you want to do resisted closing, you can do that either with your fingers on your teeth, pushing into your fingers. Please don't bite your fingers with this, but essentially open, close against resistance. You can also do that with your jaw. For protraction, you're going to be pushing forward against your hand. For retraction, you're pushing against your thumbs. Again, you're going to focus probably more on one side than the other. If you're feeling any clicking or popping in your jaw, you're probably going too hard and entrapping the disc a little bit. Back off on the intensity and maybe even do a regression and focus more on the mobility than the strength itself. For each of these exercises, you want to hold them for about 10 seconds and do about 5 reps twice a day. The other thing that's really helpful for the jaw is to actually do some manual muscle release on the muscles. So you're going to focus on the masseter here on the sides of the cheek, the medial pterygoid up underneath the jaw, and your temporalis tendon here on the side of your head. All of these, use a little bit of lotion on your thumb, find some sore spots on that muscle, and start to work slowly into it. You can either push just straight into the muscle and hold, or one of the things you can do is kind of slide along the muscle. If you are just pushing straight into the muscle, support the jaw on the other side with your hand so that you're not just pushing your jaw to one side or the other and potentially increasing your jaw pain. For these ones here on the back, you're going to be pushing up into the angle of the jaw. We don't want to push into the throat towards the lymph nodes and glands. We really want to be working into the muscle right on the edge of the bone. For temporalis, you're essentially giving the sides of your head a nice massage, working into these tendons here. All of this together will help with clenching and any pain that's related to that. Now, if your discomfort persists please do see a healthcare provider. They can help you out with maybe a splint, or one of the products we sell here at my lab is the Aqualizer, which is a temporary splint that uses water to help relieve some of the discomfort with your jaw. The last tip I'm going to leave you with is that if you're finding just a lot of discomfort and tension in the jaw, one of the best things you can do is just push the tip of your tongue to the roof of your mouth right behind your teeth. And that little bit of pressure will help to open up the jaw a little bit and give you some relief. Thanks for watching.